Today we are going to talk about headaches, different forms of headaches. Headache is a symptom. It can't be measured, like body ache, like the immune system, like depression, like sort of not feeling well. All these things can't be measured unless you put it on a scale of 1 to 10. How strong is your headache? You say 4, 5, so you can measure it that way. But as such, there are no instruments that can be used to measure headaches. So that is a problem. Now there are different types of headaches, and I'll be going through them. Now, one of the severest form of headaches is the migraine. Migraine comes from the word hemicrania, half the head. So all migraine headaches are half-sided, either left or right. Then migraines are cyclical. They'll come every month, every 3 months, once a year. They are cyclical. They're called differently, but they are usually in women. They usually come before the periods. Every month. 3 days, 4 days before the periods or just before the periods, you get the headaches. It is very severe, accompanied by nausea, vomiting, photophobia. You can't look into bright light and you can't hear loud sound. You want to stay in one corner, but it lasts for 3 days, as if it's a flu. It comes with some aura and symptoms, lasts for 3 days to 3 days, and then it goes away. And then until the next month, there's nothing at all. So that's migraine, one of the severest forms of headache. Now, all migraines are headaches, but not all headaches are migraine, because migraine, as I said, is like a disease, like a drama that comes for 3 days. Something goes wrong within the body, hormonal problems, emotional problems, and the cycles that we have, day-night cycle, monthly cycle, seasonal cycles, yearly cycles. There's so many cycles, controlled by the planetary system, and so many different things which are controlling our lives, our bodies. So, but there are different types of headaches. So in order to classify that, we have put them into some groups. So you have one form of headache, which is not a migraine, which is one-sided. Now usually one-sided headaches are because of 2 major causes. One is problems with the neck, when you don't get enough blood to the brain, when one side is very tight and the blood supply to the brain gets affected and you get this throbbing headache. It can come anytime, depending on whether you have had a whiplash injury that you get continuous for 2 weeks, 3 weeks, a month, and then you have traumas due to excessive use of computers. You're stressed in one position for hours on end, and then all the joints get stiff and the blood circulation to the brain gets affected. Then you get postural problem. You're on the phone all the time in a particular way, and all this neck gets affected, the muscles get stiff, blood flow gets affected, you get headache. Then you have problems of sleeping, very thick pillows, your neck is bent like that, or you're driving a lot, excessive driving, where your neck is kept sort of more or less still to look at the windscreen, look at the road. So all these are neck-related problems. Also, to that we can add arthritic neck changes, fibromyalgia or polymyalgia rheumatica, when you get rheumatic pains in the neck. When you get osteoporosis, the neck shrinks a little bit as you lose calcium from all these areas. The disc shrinks and there's tightness and there is obstruction of blood flow through this artery, and you get this headache. Insomnia, you're at night tossing and turning and tossing and turning, not sleeping, not allowing the muscles of the body to relax, not allowing the neck to relax. So this tossing and turning causes headaches the following day. So that would be more or less one-sided headache. But another big cause of one-sided headache is the TMJ. You know, you have the jaw joint. You place your finger in front of the ears, open your mouth, close it, and you'll find the jaw joint, which is basically a joint which moves the jaw up and down. So when that gets very tight, due to excessive stress, you're grinding your teeth and you're tensed all the time and you're angry, because when you're angry, these jaw muscles, they get very tight. It's like a biting reflex, you know, in animals. You want to bite, so you tighten the jaws. So all those emotions come into play, and then you get this tremendous stiffness, and this joint gets eroded. It may get inflamed, and and then you get one-sided headache. The temples hurt here, jaw, but this particular joint hurts. Sometimes just by massaging that, you can get rid of the headache. If you get one-sided headache and you massage the TMJ here, tympanomandibular joint, and it can go away. Similarly, if you're chewing gums all the time, you get things, you eat hard things, nuts a lot, then you have to chew and chew hard bits, of food, like steak, you have to chew a lot if you have a rare steak, and that can damage the joint here. So there's a whole lot of things, you've been to the dentist, they opened your mouth for a long time, and there's a lot of dental work going on. It's affecting the neck as well as the TMJ, and that can cause headaches, one-sided headache, left or right. And so this is a major group of headache. Then you have another group of headache which is quite important. It's often not diagnosed, is the frontal headaches, when you get headaches here. Now, behind the skull here, you have the sinuses. Now, sinuses are there to give acoustic value to your voice. When you speak, you get a little echoing there, and the voice sounds good. So, but if it gets congested, either due to viral infection or due to excessive consumption of milk products, dairy products, excessive cheese will cause it, ice cream will cause it, and drinking too much of milk can fill up the sinuses. Then they throb, because there are two holes here which drain the sinuses into the nasal tract, and that gets constricted. So the liquid doesn't come down, and you get terrible pain. You get photophobia, your eyelids are droopy, you can't look into bright light. If you look into the sun, you get headaches from that, the sun-related headaches, and all sorts of pain. Even if these sinuses, maxillary sinuses, are involved, you get problems of headaches. And you can also get that headache from chronic constipation. If you're constipated, the mucus accumulation in the body is larger. The body is trying very hard to produce more and more mucus to get the elements out. Possibly some of the toxins are absorbed and they're thrown into the sinuses as a way of getting rid of the toxins from the body. The sinuses get involved. So people who are chronically constipated, they get a strange type of headache here. especially in the mornings when they wake up. And it can last the whole day, and that is due to the sinuses, your sinus headache. Then of course you get headache due to weak eyesight, you get headaches due to some dental conditions, you get stress-related headaches, which are also frontal, but it's because of too much of thinking. You can't sleep, you can't rest, and the whole area feels congested. The frontal part of the brain gets overworked. You get the headaches. Not forgetting about brain tumors, problems of brain infection. Say if you get meningitis, one of the first symptoms would be headache. The neck tightens up, and the headaches start. That's why the Dutch word for meningitis is neck cramp. Neck cramp. It tightens up, and then you start getting these headaches. Then you have the circulatory headaches. The brain is surrounded by cerebrospinal fluid. It makes the brain buoyant. It floats, in order to prevent the trauma of the soft brain tissues against the skull. You have the fluid buffer, which prevents it. So you move in all directions, you play sports and all that, and you don't smash your soft brain tissue. It automatically gets prevented by that. So that is another condition which can it has to be taken into account. Sometimes spinal tap, you drain too much of the cerebrospinal fluid, the fluid is absent in the brain, and you'll get terrible headaches. As I said, with encephalitis and meningitis and all sorts of inflammation of the brain tissue or the membranes of the brain, and then you get excess mucus production, excess fluid there, and that applies pressure on the brain. When children, they are born with hydrocephalus, a lot of fluid in the brain, they have pressure on their brain, they cry a lot, and it's because of headaches that they get. Then you get headaches due to high blood pressure, which is usually at the back of the head, occiput, and the neck. It just throbs, it continues, makes you very moody, makes you very irritable, you get angry. If a person is having headache in the back of the head and in the neck area, and is very moody and irritable, think of blood sort of pressure. If you measure the blood pressure, it will show it. If the pressure is low, you also get headache. So high blood pressure, you get headache. Low blood pressure, you get headache. The low blood pressure is all over the head, and you feel tired, and also a bit, sad as well. You yawn a lot to get more and more oxygen into the system, and if you're sleepy, the eyes feel droopy, and so that's the low blood pressure. High atmospheric pressure, you get headache. Low atmospheric pressure, you also get headache. And you get headache from digestive problems, when you have too much of toxins, candida infection, and then your digestive system is poor. You absorb all sorts of toxins, you get headaches. Sometimes certain types of tablets can give you headaches because of the toxic effect. Then if you have general problem of poor circulation and poor immune system, everything is low, you get a constant headache, and you pop pills in to cure that. So there are so many different types of headaches. So I'll be doing a series of YouTube videos to explain how to understand the different types of headaches and what remedies you can take in terms of I'm not going to talk about heavy duty drugs, but certain things to prevent these headaches, to control these headaches through massages, through exercising, through different types of breathing exercises to get more oxygen into the blood, and through rest, stress management. So wait for these YouTube presentations. There's a lot coming. Welcome.